10 high blood pressure signs, the silent killer you're ignoring. Right now, as you're watching this video, there's a 46% chance your blood pressure is quietly damaging your organs without you even knowing it. Think you'd feel sick if your blood pressure was dangerously high? Think again. Millions of people are walking around with a silent killer coursing through their veins, feeling perfectly fine, until they're not. What if your body has been trying to warn you all along, but you've been missing the signs? High blood pressure affects over 1 billion people worldwide and kills nearly 10 million every year. It's called the silent killer because it typically shows no symptoms until it causes a heart attack, stroke, or organ failure. Here's the scary part. Globally, 46% of adults with hypertension have no idea they have it. Today, we're uncovering the 10 signs that your blood pressure might be silently damaging your body. Some of these will surprise you. Please note, this video is for informational purposes only and not a substitute for medical advice. All information provided has been carefully verified. Source links are available in the description. Now, let's get started with sign 1, headaches. That throbbing in your head might be more than just a typical tension headache. When related to high blood pressure, headaches present with distinct characteristics that set them apart. They are often described as severe and pulsating, and unlike a migraine, they tend to affect both sides of the head simultaneously. A key indicator is their timing. These headaches commonly appear in the morning, shortly after waking, and can intensify with physical activity. The connection isn't just anecdotal, it's statistically significant. Research reveals that a staggering 79.9% of hypertensive patients report experiencing headaches, compared to 71.6% of individuals with normal blood pressure. A large German multi-center study involving over 2,000 untreated hypertensive patients solidified this link, finding a clear and direct association between headache frequency and the severity of blood pressure levels. These findings confirm that headaches are a genuine and prevalent symptom of uncontrolled hypertension. The physiological process behind this pain is a direct consequence of extreme pressure. High blood pressure compromises the integrity of the blood-brain barrier, a protective shield that regulates substances entering the brain. This breach allows fluid to leak into brain tissue, causing increased intracranial pressure and swelling, a condition known as cerebral edema. In a hypertensive crisis, where blood pressure spikes above 180 over 120 millimeters of mercury, this can escalate to hypertensive encephalopathy, a life-threatening emergency. The pain you feel is the result of blood vessel walls being stretched and changes in cerebral blood flow, a direct distress signal from your brain. Clinical studies show this link is strongest in these crisis moments, with the correlation between systolic and diastolic pressure and headaches showing powerful positive relationships, with R values of 0.83 and 0.90 respectively, indicating an almost one-to-one relationship. 2. Dizziness and vertigo. A sudden feeling of unsteadiness, or the sensation that the room is spinning, can be deeply unsettling. While many factors can cause dizziness, its connection to severe hypertension is a critical one to understand. This isn't just a fleeting moment of lightheadedness. It can manifest as true vertigo, a spinning sensation that disrupts your sense of balance and spatial orientation. You might find yourself struggling to walk in a straight line or feeling profoundly unsteady on your feet. This symptom is particularly common when blood pressure reaches dangerously high levels. Approximately 16% of patients with a systolic blood pressure reading over 180 millimeters of mercury report experiencing dizziness. A comprehensive 2023 study that included over 2,000 participants further confirmed a significant and undeniable association between feelings of dizziness and the presence of severe hypertension. This data highlights dizziness not as a random occurrence, but as a potential marker for critically elevated blood pressure that demands attention. The mechanism behind this disorienting symptom lies in the delicate vascular network of your inner ear. Your vestibular system, responsible for maintaining balance, relies on a steady supply of blood through tiny, sensitive vessels. Chronic hypertension damages these vessels, impairing their function and disrupting the signals sent to your brain about your body's position in space. Furthermore, persistently high blood pressure significantly increases your risk of stroke, an event that can directly damage the brain centers responsible for coordinating balance. German clinical research has quantified this relationship, demonstrating significant correlations between both systolic and diastolic blood pressure and dizziness, with R values of 0.73 and 0.76. This association is especially pronounced in elderly populations, where hypertension-induced dizziness is a leading contributor to falls and related injuries. 3. Chest pain. Chest pain is an alarming symptom that should never be ignored, and when linked to hypertension, it can signal serious cardiac distress. The sensation isn't always the sharp, stabbing pain often depicted in movies. It can present as a persistent pressure, a constricting tightness, or even a burning feeling in the center of the chest, a condition known as angina. In the context of high blood pressure, this pain can be a warning of an impending acute coronary syndrome, such as a heart attack. The numbers clearly show that those with high blood pressure are more likely to experience this symptom. Research indicates that 49.7% of individuals with hypertension report chest pain, a statistically significant increase compared to the 39.8% of normotensive individuals who report it. This difference underscores the direct impact that elevated blood pressure has on the cardiovascular system. It's a clear indication that the heart is struggling under an increased load. The physiology behind this pain reveals a heart in overdrive. Hypertension forces your heart to work much harder to pump blood throughout the body, causing the heart muscle, particularly the left ventricle, to thicken and enlarge, a condition called left ventricular hypertrophy. This enlarged muscle demands more oxygen, but the heart's blood supply may not be able to keep up, leading to angina, even if the coronary arteries aren't significantly blocked. Over time, hypertension also accelerates atherosclerosis, the buildup of plaque in the arteries, dramatically increasing the risk of a blockage that can cause an acute coronary event. The American Heart Association identifies chest pain as a cardinal symptom of a hypertensive emergency, especially when blood pressure exceeds 180 over 120 millimeters of mercury, making it a critical warning sign that requires immediate medical intervention to prevent permanent heart damage. 4. Tinnitus, ringing in ears. Do you ever hear a ringing, buzzing, or whooshing sound in your ears that no one else can hear? This phenomenon, known as tinnitus, has a surprisingly strong connection to high blood pressure. In some cases, the sound is not a steady tone, but is pulsatile, meaning it presents as a rhythmic whooshing or thumping that synchronizes perfectly with your heartbeat. This specific type, pulsatile tinnitus, is a particularly telling sign of a potential vascular issue. While tinnitus can have many causes, research has established a significant association between the symptom and hypertension, a link that becomes even stronger in older patient populations. In fact, numerous studies identify high blood pressure as one of the most common and identifiable causes of pulsatile tinnitus specifically. It's not a symptom to be casually dismissed as a part of aging. It could be your auditory system signaling a problem with your circulatory system. The underlying mechanism can be twofold. In the case of pulsatile tinnitus, the cause is often mechanical. Chronically elevated blood pressure increases the force and turbulence of blood flow through the major vessels in your head and neck, such as the carotid artery, which runs close to your ear. This turbulent flow becomes audible, creating the pulsing sound. In other cases, hypertension can inflict damage on the delicate, microscopic blood vessels that supply the cochlea and other structures of the inner ear. This vascular damage impairs the function of the auditory system, leading to the phantom sounds of non-pulsatile tinnitus. A definitive case control study confirmed these positive associations, noting that the relationship was most robust in older patients and that individuals with tinnitus were more likely to be on antihypertensive medications, reinforcing the strong clinical link between the two conditions. 5. Blurred vision and visual changes. Your eyes are unique in that they are the only place in the body where a doctor can directly view blood vessels without making an incision. This makes them a remarkable window into your vascular health, and visual disturbances can be one of the earliest and most direct signs of damage from hypertension. These symptoms can range from subtly blurred or double vision to more alarming issues like defects in your visual field, or, in severe cases, sudden and total vision loss. These changes can develop gradually over time or appear acutely during a blood pressure spike. The prevalence of vision problems among hypertensive patients is striking and statistically significant. Studies show that 58.7% of individuals with hypertension experience vision problems, a sharp contrast to the 39.8% of people with normal blood pressure. This data moves visual symptoms from the realm of coincidence to a core, recognized complication of the disease, highlighting the profound impact that systemic blood pressure has on the delicate structures of the eye. The primary mechanism for this damage is a condition called hypertensive retinopathy, where high pressure inflicts progressive harm on the tiny blood vessels of the retina. This condition is clinically graded in 4 stages. It begins with the narrowing of retinal arteries, arteriolar narrowing, progresses to the compression of veins by stiff arteries, arteriovenous nicking, then leads to leakage from vessels causing fluid buildup and deposits, exudation and cotton wool spots, and culminates in dangerous swelling of the optic nerve edema. Beyond the retina, hypertension can also cause choroidopathy, damage to the vascular layer beneath the retina, and optic neuropathy, damage to the optic nerve itself. A landmark 2013 study published in the journal Hypertension tracked 2,900 patients for 13 years and found that even mild forms of hypertensive retinopathy increase the risk of stroke by a staggering 35%, proving that what happens in the eye is a direct reflection of risk in the brain. 6th, facial flushing. A sudden, unexplained reddening of the face and neck, often accompanied by a distinct feeling of warmth, can be a startling experience. This symptom, known as facial flushing, can be triggered by stress, heat, alcohol, or spicy foods in anyone. However, when it occurs without a clear trigger, it can be associated with acute and severe elevations in blood pressure. It is important to distinguish this from the chronic, persistent redness seen in conditions like rosacea. While facial flushing is not considered a classic symptom of chronic long-term hypertension, it is a recognized sign that can accompany a hypertensive crisis. During these events, when blood pressure soars to dangerous levels, the body's systems are thrown into disarray, and flushing can be one of the visible manifestations. It serves as a temporary but visible alert that your circulatory system is under extreme duress. The physiological cause of facial flushing is straightforward. The blood vessels in the skin of your face dilate or widen, allowing for a sudden rush of increased blood flow. In the context of a hypertensive emergency, this dilation can be part of the body's complex and sometimes chaotic response to the sudden spike in pressure or the surge of stress hormones that often accompanies it. The visible reddening is simply the result of more blood flowing through the superficial capillaries just beneath the skin's surface. Clinical research supports this understanding, indicating that flushing is more often an acute, transient symptom linked to sudden blood pressure spikes rather than a reliable indicator of sustained high blood pressure. Therefore, if you experience sudden, unexplained facial flushing, especially alongside other symptoms like a severe headache or shortness of breath, it should be treated as a potential warning of a hypertensive emergency that warrants immediate evaluation. 7. Shortness of breath, dyspnea. Feeling as though you can't get enough air, whether during physical exertion or even while at rest, is a frightening symptom known as dyspnea. For individuals with hypertension, this shortness of breath can be a sign that the condition is beginning to take a serious toll on the heart and lungs. The sensation might worsen significantly when you are lying down. This symptom is more common in the hypertensive population than you might think. Research data indicates that 55% of hypertensive patients experience shortness of breath, compared to 48.9% of their normotensive counterparts. While the percentage difference may seem modest, the symptom itself points to a potentially severe underlying complication, particularly in the context of pulmonary hypertension, where dyspnea is a hallmark sign. The mechanism behind hypertensive dyspnea is directly tied to the heart's function. Years of pumping against high pressure causes the heart to weaken and stiffen, potentially leading to congestive heart failure. When the heart can no longer pump blood forward effectively, fluid can back up into the lungs, a condition called pulmonary edema, which makes it physically difficult to breathe. A separate but related condition is pulmonary hypertension, where the pressure, specifically within the pulmonary arteries, becomes dangerously high. This makes it incredibly difficult for the right ventricle of the heart to pump blood into the lungs, resulting in reduced oxygen delivery to the entire body and a profound sense of breathlessness. Studies show that shortness of breath is often the very first symptom of pulmonary hypertension, a serious condition that affects approximately 1% of the global population and signifies a critical progression of cardiovascular disease. 8. Erectile dysfunction. Erectile dysfunction, or ED, is a deeply personal issue that can significantly impact quality of life and relationships. It is medically defined as the persistent difficulty in achieving or maintaining an erection sufficient for satisfactory sexual activity. While often associated with psychological factors or aging, it is crucial to recognize that ED is frequently an early and powerful indicator of underlying vascular disease, specifically hypertension. The link between high blood pressure and erectile dysfunction is not a matter of chance. It is a well-documented medical fact. Research demonstrates that the prevalence of erectile dysfunction is approximately 2 times higher in hypertensive men compared to men with normal blood pressure. Multiple studies and large-scale meta-analyses have consistently confirmed this strong positive association, solidifying ED as a major comorbidity of hypertension. The physiological connection lies in the health of your blood vessels. A successful erection is a purely vascular event, requiring a rapid and significant increase in blood flow to the penis through small, specialized arteries. Hypertension systematically damages the delicate lining of blood vessels throughout the body, a process that is particularly detrimental to the tiny arteries found in the penis, which measure only 1 to 3 millimeters in diameter. This damage narrows the vessels and restricts blood flow, making it physically impossible to achieve or sustain an erection. Because these penile arteries are among the smallest and most sensitive in the body, they are often the first to show signs of hypertensive damage. For this reason, clinical researchers now view the onset of erectile dysfunction as a potential canary in the coal mine, an early warning sign that the same vascular damage is likely occurring in larger, more critical arteries, like those supplying the heart and brain, years before a heart attack or stroke might occur. 9. Anxiety and panic symptoms. The mind and body are intricately connected, and this is especially true in the relationship between anxiety and high blood pressure. Hypertension can manifest not just in physical symptoms, but in psychological ones as well, such as excessive worry, a persistent sense of restlessness, or even full-blown panic attacks. This can create a vicious cycle, where the physical state of high blood pressure fuels anxiety, and the psychological state of anxiety, in turn, worsens blood pressure. This is not a one-way street. Research confirms a distinct bidirectional relationship between the two conditions. Studies consistently show that people diagnosed with hypertension are significantly more likely to also experience clinical anxiety than those with normal blood pressure. Conversely, individuals with chronic anxiety disorders are at a higher risk of developing hypertension over time. This interplay means that managing one condition is often crucial for successfully managing the other. The physiological mechanism behind this cycle involves the body's stress response system. Hypertension can overactivate the sympathetic nervous system, the part of your nervous system responsible for the fight or flight response, leading to feelings of hypervigilance and anxiety, even in non-stressful situations. On the other hand, when you feel anxious or have a panic attack, your brain triggers the release of stress hormones like adrenaline and cortisol, which cause your heart to pound and your blood vessels to constrict, leading to an immediate and sharp increase in blood pressure. A comprehensive 2015 review of 13 different studies confirmed this powerful reinforcing link. A perfect clinical example of this connection is white coat hypertension, a phenomenon affecting about 20% of patients, where blood pressure is normal at home, but spikes in a medical setting due to anxiety, vividly demonstrating the power of the mind to influence cardiovascular function. 10. Fatigue and weakness. Feeling perpetually tired, lacking energy, and finding that even minimal physical activity leaves you exhausted is a common complaint. While fatigue can stem from countless sources, persistent and debilitating tiredness can be a direct consequence of uncontrolled high blood pressure. This isn't just feeling sleepy. It's a profound sense of weakness and a marked decrease in your exercise tolerance that can interfere with your daily life. The data supports this connection, showing a consistent pattern among hypertensive individuals. Research indicates that 71.8% of patients with hypertension report experiencing fatigue, compared to 69.3% of those with normal blood pressure. Although this difference is modest, the symptom is one of the most consistently reported complaints in clinical settings, suggesting it is a real and impactful aspect of living with the condition. The underlying physiology explains why hypertension can leave you feeling so drained. When your blood pressure is high, your heart must work significantly harder to pump blood through narrowed or stiffened arteries. This increased cardiac workload consumes a massive amount of energy, leading to systemic fatigue. Furthermore, hypertension reduces the overall efficiency of your circulatory system, meaning less oxygen and fewer vital nutrients are being delivered to your muscles and organs, further contributing to a feeling of weakness and reduced functional capacity. Additionally, other hypertensive symptoms like anxiety, shortness of breath, or frequent urination at night can disrupt sleep patterns, compounding the problem of daytime fatigue. Fortunately, studies show that this persistent fatigue is not a life sentence. It is recognized as a common symptom that often improves significantly once blood pressure is brought under control with effective treatment, restoring energy levels and improving overall quality of life. Thank you for watching and supporting our work. If you found this helpful, please give it a like and subscribe for more content like this.